Cumberland County Board of Health meeting in the year 2022. Today is February 15th. Remember to please mute your phones, cell phones, and other electronic devices so as to minimize disruption. And thank you for taking the time out of your busy schedule to attend today's meeting. Can we observe a minute silence, please, to unwind and focus on this meeting? Thank you very much. To establish a quorum, I will call on the names of board members I see present. Let me know if I unintentionally leave your name out. I see Dr. Jeanette Canto, Dr. Kent Dean, Mr. John Latch, Dr. Jennifer Grable-Locklear, Mr. Joseph Pfizer. Anyone else?
Yes,
Dr. Al-Sadi, present.
Thank you. Anyone else?
Kiara Wade.
Hi, Ms. Kiara Wade. Thank you.
This is
Anyone
Dr.
else?
Fleishman. This is Dr. Fleishman. I just got on.
Thank you, sir. Thank you, Dr. Fleishman. Thank you. May I please ask the Department of Health staff members present and others to please very briefly introduce themselves?
Jennifer Green, Director of Cumberland County Health Department.
Thank you.
Ashley Curtis, Deputy Health Director.
Lori Hagler, Medical Director.
Thank you.
Candy York, Accountant for the Health Department.
Thank you.
Kelly Smith, Administrative Assistant.
Director of Nursing.
Thank you. Anyone else? Thank you very much. Please take a look at the agenda for today's meeting. May I please have the motion to approve?
Motion to approve.
Second.
Second? All in favor?
Aye.
Aye.
Thank you very much. I believe you all had the opportunity to go through the last meeting's minutes on pages 2 to 5 of the package. Do we have any comments or corrections on this? If none, may I please have the motion to approve the meeting minutes?
Motion to approve.
Second?
Second.
Second.
All in favor?
Aye.
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 Thank you. Next on the agenda is the of the 2022 Book of Health. And I believe we've all had time to review. Yes. Pages 7 through 12 of the packet basically highlight the standard of. Thank you. On pages 7 through 12 of your packet, it basically highlights the standard operating procedures and streamlines the step-by-step process of what we do as a board so as to remain consistent and in compliance with the industry regulations and standards. This operating procedure is reviewed annually. If you skip to page 13 through 18, that is basically the Cumberland County Department of Health compliance with public health laws and regulations policy. And basically the purpose of this policy is to ensure that the Cumberland County Board of Health and the Cumberland County Department of Public Health employees, that we consult and we follow the federal, state, and local laws and regulations. And also that we follow the current recommendations of regulating and advisory agencies so as to deliver the essential and mandated public health services. If you go to page 29 through 32, these pages basically details the policy and procedures for hearing appeals to Board of Health, as delineated in Chapter 130A of the North Carolina General Assembly Statute, also known as the Public Health Laws of North Carolina. On pages 33 through 36 is the Board of Health Education Policy. And basically, this ensures that the Department of Public Health follows procedures for education as outlined in Chapter 130A, Section 24 of the General Statute. Do we have any comments, questions, please, on the 2022 Board of Health Handbook? Comments, please. Questions?
I guess I'll point out that we haven't had any substantive changes to the Board of Health Handbook. The only change that we updated was the availability of a virtual option for the Board of Health orientation training. And so that's the major change that we've made for 2022. But the policies don't have any, other than correcting minor grammatical things, we don't have any substantive changes to the Board of Health Handbook.
I move that we accept the policy, please.
Thank you. Second?
Second.
Heidi, second.
All in favor?
Aye.
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 Thank you. Moving on to item 3 on the agenda. The floor is now open for public comment, please.
We do not have anyone registered for public comment.
Thank you. We will now close the floor for public comment and call on Mrs. Candy York to please present the financial reports as on pages 37 through 42 of your packet. Mrs. Candy York, please.
Good evening. Beginning on page 37, we have our statement of revenues and expenditures for the month closing January 31st, 2022. At the close of month, including revenue that is due from the state and from the school system, our revenues exceeded our expenditures by $500,965.57. On page 38 is a listing of expenditures by program. At the close of the month, we had expended 38.4% of our budget. However, I want to draw your attention to the fourth line from the bottom, where we have expenditures for COVID-19 in the amount of $5.8 million budgeted there. Those funds are allocated for specific purposes, and some of them are multi-year funds that will actually roll over based on what's not expended through this fiscal year. So to get a better account of really where we're at as far as spending our budget, if you take that particular program out to be in line, we're actually spent 46% of our budget instead of the 38. Just want to give you a truer picture, because by this time of the year, if we had spent 100% of what we actually had budgeted, which of course we know never happens, we would have spent around 58% of our budget. And so that 38% I know looks really low. So I wanted to sort of take that COVID piece out just to give you a truer number, which I said, of course, is 46%. Moving on to page 39. You have your revenues listed by source, beginning with our state and federal allocations. Followed at the bottom of the page are grants. On page 40, reflects our Medicaid collections, followed by the fees, which is, of course, comprised of third-party private insurance collections and also self-pay payments. Then listed our fund balance that had been appropriated, and then county funds also. So through January 31st, the county revenue collections is $4,809,887 that the county has put forth toward our programs at the health department. Overall, we've collected 40.2% of the revenue we had budgeted for the fiscal year. And there again, if I would back out the COVID revenue to give you a truer picture of where we're at, we're really at 49% of revenue collection instead of the 40%. On page 41 is the accounts receivable report by program and actual payer source. And then on page 42, this reflects the aging of our private pay, self-pay accounts receivable. And then I wanted to briefly mention too that we're in the preparation now of preparing our fiscal year 2023 budget. We have until February 28th to data entry all of our anticipated operating expenses that we will have for fiscal year 2023. And so next month, we'll actually be presenting that information to you to show you what we've actually requested of the county for recurrent operating expenditures next year and any supplemental operating expenses that we anticipate having. But I'll be happy to answer any questions in regards to the financial reports for the month or the budget process, if there are any.
Any comments, questions, please, on the financial report? One question I have for you, Mrs. Candido. Under the expenditure by program, we have found a way to separate the COVID-19 from the main.
You would like me to actually separate that out in the report next month?
I'm asking, is that possible? That way we can have a true picture of that.
Yes, ma'am, I can definitely do that.
Like you can put it at the very bottom. That way we can, it's kind of separate. And that gives us a true picture of the expenditures.
Yes, ma'am, I will definitely do that.
That will give us a true picture of the grant total revenue that we end up spend. Is that good? Am I clear?
Yes.
Okay. Does anybody have any comments or questions for Mrs. York on the financial report? If not, thank you so much, Mrs. York.
Thank you. Good evening.
I will now call on Dr. Jennifer Green to please present the 2020-2021 report on the North Carolina School Health Services, and then move on to your director's updates.
Yes, thank you, Dr. Ojo. So we actually do not have it in the report that's in your packet this month. So this is an annual report from School Health that we present to the board. It comes from the state of North Carolina. I'm just going to scroll back to the beginning of the packet here. It gets reported from the state of North Carolina, and typically what's available is Cumberland County data as well as statewide data related to school health nursing and the availability of school health nurses in each school, and then typically we also get a breakout of services that are provided, services that we performed in school. This year, we don't yet have our county level reporting, or our county level report back from the state yet. So what I'd request is that, or what I'd offer to the board is that we're going to move this agenda item and have the full report for you next month once we have the school health data that's at the county level. We only right now have our statewide data. I want to be able to present both of those pieces for you together. So we'll do that next month, and then the next piece that you can anticipate next month at our board meeting. This week we are finishing up our women's health audit, both for family planning services and maternity services at the health department. You can expect that we'll have, if the final report is written from our state consultant, a report. We have our exit conference this week for that report. And then also this week we have our WIC audit. So that is going to take place on Thursday of this week. So the WIC audit may not be available. The results of that may not be available by our next meeting, but I anticipate that our women's health audit will. So you can expect to see those reports next week. So I'll move to our director's report. And I'm going to go a little bit out of order. I'm going to move the COVID-19 update to the end so we have time for discussion. The first agenda, let me make this a full screen. So we're going to start with an update on our strategic planning process. Thank you to the board members for helping and participating in our Board of Health retreat last week. We implemented that process, that retreat as part of the Thank you. And so the board members had the opportunity to review several data sources. We reviewed the county health rankings, and we were sent the State of the County Health Report. We looked at the 2019 Community Health Assessment, as well as preliminary findings from the 2022 Community Health Assessment. We reviewed some of our health department utilization data, and then had an overview on progress towards our 2021-2022 strategic plan. The board members participated in a SWOT analysis in which they identified strengths, weaknesses, and opportunities and threats to the health department and the community as it relates to public health. Then the board members participated in a nominal group process in which we worked in small groups to develop strategic priorities for the agency for the next 5 years. Then that feedback was taken, and we did some round robin discussion about those priorities, and then voted on top priorities for the health department. In addition, so these are where we settled on, and then I'll give you some next steps here. So we really settled on priorities related to increasing collaborations with the community and our military population, recruitment, retention, and of staff, and improving staff morale, health education and health literacy, substance abuse and mental health, reduction in our STI incidence rates here in the county, utilizing and implementing technology, including with our EHR, which we'll hear about in just a moment, expanding our health department services, transportation to health department services, communication about the work that we do at the health department and what public health is and what public health does, and then also normalizing our COVID-19 response into our normal operations of the health department. So the next step is for our internal strategic planning team to take these priorities and to develop them into goals and objectives based on the priorities set forth by the board. So we'll do that over the next several months. We'll develop goals, objectives, and action steps, and then provide the board members updates and the public updates as we go through that process. So that will be ready for implementation by January of 2023. And we'll have the formal plan for you to approve late this year or early next year. A quick update about QRMD. This was a priority for the board in our current strategic plan. There was a delay partially due to COVID in the selection of our EHR. However, late last year, we selected QRMD as the EHR for Door County's RFP process. So thus far, we've launched our sort of the build out of QRMD. We've held discovery sessions with the vendor. We completed our practice management super user sessions for our super users in the health department. We're working with IT right now on data migration from our old EHR to our new EHR. Right now, this week and in the next couple of weeks, we'll be doing our EMR super user sessions where we're really getting into the clinical side of what the platform is going to look like. And then we anticipate that we'll have staff training and the go live date somewhere in April. It could be a little bit earlier where the process is going very smoothly, knock on wood, and we will, but it may be as late as May. So we'll keep the board updated. Two pieces are part of our previous strategic plan that I wanted to just bring to the attention of the board that will be included in this. Let's make sure that we have text reminders for individuals as it relates to their appointments so that we can decrease our no-show rates. And then we've talked a lot about having a patient portal available. So both of those things are available in our new EHR. The next update, we talked a little bit about this in a previous meeting, but I just wanted to bring this back to the forefront and for the benefit of the public. We have received funding from the American Rescue Plan and to make sure that we can broaden our public health workforce. So this is funding from the CDC in collaboration or pass-through funding through our state health department. And this funding really focuses on improving the public health infrastructure, specifically expanding and training our public health workforce. This is a regional grant. And so the health department, Cumberland County, is the lead agency for our public health region. And so we will serve as the fiscal agent for this grant. And we are focusing on two pieces. One, training of our staff to make sure that we're prepared and ready to respond to public health emergencies, that we have strong communication efforts, data efforts. And the second piece is to make sure that we have a workforce that is well developed. So that may mean getting personnel to build out our public health infrastructure. So that funding is here. There's a bit of a delayed start due to the budget at the state level. It's 2 years of funding through next June of 2023. So we're getting work started on that. And this week we posted this funding will support the hiring of a workforce development director. And we posted that position this week. Related to that, we also received funding to advance health equity. This is funding related to COVID-19 as it specifically relates to health disparities and expanding our capacity of our services. Again, related to COVID, but also in general, it's making sure that we're providing equitable services. So this is really going to support training on health equity for our staff, including health literacy, which again ties back to the strategic plan priorities that the board just set forth. We'll have an internal and external work group related to health equity, and we'll be developing that internal work group first and then looking out to the community for an external work group. And then we'll be reviewing our organizational policies and procedures as it relates to health equity. We also were awarded a Delta Dental grant. This is a grant we typically receive annually. This year we received $2,400 as part of the Smiles for Kids grant. That funding is being designated specifically for a program called Healthy Smiles and Self-Esteem. We'll be implementing at elementary schools at the 5th grade level. And the focus here is on improving oral health in primary age school kids by raising awareness on oral health. So participants will participate in a poster contest, and we'll also have dental hygiene kits for the classrooms that are participating. So I'll pause there and see if there are any questions about those items before we move to our COVID-19 update. I'm hearing none. I'll give the disclaimer that I always give about the pandemic, that this information is rapidly changing. The information on the slides are current as of today. And we have some links on here, and for those that are watching online, that you can go to for up-to-date information if you're watching this at a later date. So we'll start with our COVID-19 data. This is from the CDC's data tracker. They utilize several measures to determine community transmission. So we look at a number of COVID-19 metrics. There's no one perfect metric, but we look at several metrics as we monitor cases in transmission levels in our county. So the first one is about our number of cases, and we typically look at this, we call this our case rate. Our case rate over the last 7 days. And so this has been updated today. And so in Cumberland County, we've had more than 1,000 cases in the last 7 days. But that brings us to a case rate of 551 cases per 100,000 residents. You'll see on the next slide that we'd like this number to be closer to 5%. I'm sorry, that number to be under 100. And so we're higher than where we need to be, but our cases are declining, and we'll see that in just a moment. We also look at our case positivity rate. That is about 24.5%, and we've had 519 deaths in our community. As identified by the CDC, we're still in a community of high transmission, and that's defined by two metrics: our case rate, our cases per 100,000, which again, you'll see highlighted here in red. We'd like that number to be less than 100 to get us out of the high transmission. And currently it's at 500. And then you also see the percentage of tests that come back to us positive. We'd like that ideally to be closer to 5%, and we're above that at this time. This page, this chart shows our progress in cases since the beginning of the pandemic. And so you can see the top chart shows our cases per 100,000 in the last 7 days. The big spike on the right-hand side is due to the Omicron variant. We saw a sharp increase right after the holidays. The good news is that we're starting to see a decline in our cases due to the Omicron variant. So we are certainly in a decline. Our metrics are improving, but certainly higher than where we'd like to be. The bottom chart shows our deaths since the beginning of the pandemic. We have seen an increase in our death rate. The first peak that you see was really due last January, right before vaccines became available. And then you can see the sharp drop right after we started vaccinating individuals. The good news is the Omicron variant, while it's much more contagious, and that's reflected in our higher case rates, we're seeing fewer hospitalizations and fewer deaths due to this variant, let me say that differently. We're seeing fewer deaths due to the Omicron variant, as it seems to be causing less death than the Delta variant. So this chart just shows a little bit about where we were, and we're going to be talking about the public health abatement order tonight. So I just want to provide some context about where we were. So on the top chart shows, that red arrow shows about where we were when we first implemented that order, and for cases. So you can see that we're heading in the right direction. Our cases are declining. We're still higher than where we were when we first implemented the order, but our cases are declining. In terms of death, we've seen we had a higher spike in our death rate at the time we put the public health abatement order, but as I mentioned, we've seen less of an impact on death due to the Omicron variant. However, I'll note that death tends to be an indicator that lags behind, and so we may not see that result right away. This is Cumberland County Schools data, and I did 2 weeks of comparison, the most recent week that completed on Friday, compared to about a month ago, data about a month ago. So about a month ago, we had more than 1,600 cases among students and staff that tested positive in Cumberland County schools. Last week, that dropped to 321 cases, so that's good. And we had 1,100 students in quarantine about a month ago, and that dropped down to 208 largely due to the implementation of the Test to Stay program, which allowed individuals to stay in school after COVID-19 exposure with some stipulations in place. The case positivity rate that you see here is Cumberland County Schools specific data as it relates to their testing program. So in about a month ago, we had a case positivity rate of about 38.6%, and that's dropped down to 25.5%. So our metrics, the key here is that our metrics are improving. We're seeing a drop in our cases. However, they remain higher than we would like them to be. And then on the very last bottom row there, we track the number of clusters, which is defined as 5 or more cases that have some epidemiological link to them. And about a month ago, we had 5 clusters that we identified in the schools, and this past week we did not identify any clusters. This chart reflects our hospitalization data, and this is a collection from the CDC's data tracker. And so you can see it's ebbed and flowed with over time with the Delta variant and with the Omicron variant. We are starting to see a decline in our hospitalizations, so that's good news. They're still elevated and we're higher than we would like for them to be, but we are starting to see a decline in the hospitalization. We've had today there were 106 patient admissions that are currently in the hospital, 15 adults in the ICU, including 12 that were on ventilators, 2 pediatric patients, and 11 patients in the emergency department. This is our Cumberland County vaccination data. So this is our Cumberland County vaccination data. We've had, in Cumberland County, we have a bit more than half, almost 60% of our residents are fully vaccinated. That's including individuals there in the red box that are not yet eligible to be vaccinated. So individuals that are under the age of 5. If we pull out only those that are eligible to be vaccinated, so those that are 5 and older, we're at about 64, almost 64% are fully vaccinated. If we look at individuals that have had just at least 1 dose, we have about 85% that have had at least 1 dose. That means for me that people are not coming back and getting their second dose. So if that is you, we need you to come back and get your second dose in order to be considered fully vaccinated. So we've seen an improvement in this metric over the course of the last several months, although that progress has slowed up a bit. The next slide shows our vaccination rates by age group in Cumberland County. So I want to point out a couple of places where we're lagging behind. In the red bar at the top, that's our 5 to 11-year-olds. We have about 15% of our 5 to 11-year-olds who've had at least 1 dose, and about 12% have been fully vaccinated. For our 12 to 17-year-olds, we have about 38% that have been fully vaccinated, that have had at least 1 dose. And so there's room for improvement for those age groups. Our older adults, however, we've had very high vaccination rates among our older adults. So that population was the group that was first eligible and had very strong uptake of vaccine. If we look at this is back to our CDC data tracker. If we look at the vaccination data for our booster data specifically, so this data is among people that are already fully vaccinated, meaning they've had 2 doses of Pfizer or Moderna or a single dose of J&J, and they got their booster shot. That's the data we're looking at now. So we've had about 12% of our fully vaccinated population with a booster shot. So we really need to make sure that people are getting their booster shot. That increases the booster data, increases by age, but we need more people to come out and get a booster shot. So I want to provide a quick update on our pediatric vaccine. So we thought we had some good news from the FDA in the last couple of weeks and Pfizer. However, they reported on Friday that they have extended what we're calling their rolling submission to the Food and Drug Administration for emergency use authorization of the vaccines for children under the age of 5. So they initially submitted data to do 2-dose series for children 6 months of age to 5 years old, and that would have been 2 doses 3 weeks apart, with the idea that eventually children under the age of 5 would need 3 doses and 3 primary series doses and potentially a booster dose in the future. Last Friday, they announced that they are going to wait and submit the 3-dose data all together rather than submitting data for their 2 doses now and then resubmitting data later for a 3rd dose. But they're going to, they've seen some strong results, so they're going to wait to collect all those data points together. And this 3-dose may provide a higher level of protection. So the CDC's advisory, or the FDA's advisory committee, was actually supposed to meet today. That meeting has been shifted. It has not yet been rescheduled. So it still has to go through the FDA's advisory committee and the CDC's advisory committee. And then we hope to have, Pfizer has indicated that 3-dose data will be available in early April. And for me, that means we'll have to consider, it will take time to do the FDA's advisory committee and the CDC approval. And so maybe by sometime in the 3rd quarter or the 2nd quarter, we'll have vaccines for children under the age of 5, but just not available yet. So we do have treatment options available. The FDA has issued an emergency authorization for several treatment options. There are currently 2 antiviral pills that are available to treat mild and moderate COVID-19, particularly in high-risk patients, including those that are unvaccinated or at high risk for severe disease and illness. There's also 2 or several monoclonal antibodies that have been approved or authorized for treatment of COVID-19. All of these require a positive COVID-19 test of some type, and these treatments have been found effective in decreasing the rate of severe illness, hospitalization, and death. It is limited right now to people that are high risk first. So we have these options available, but they're limited supply right now. And they're really being prioritized for people that are either only partially vaccinated or unvaccinated, or not quite up to date with their vaccination status, or immune compromised. So the public health abatement order went into effect on Friday, August the 27th. At that time, we were at the beginning of our Delta surge and had seen a sharp increase in cases throughout the month of July. This public health abatement order required face covering in all public places for anybody age 2 and over, regardless of vaccination status. And that applied to all of the, everywhere in the county limits, including the city of Fayetteville and all of the towns and municipalities. And that, as we've talked with this board before, that abatement order was authorized under general statute in our communicable disease. So I wanted to quickly, before we shift back to the abatement order, I want to talk about current recommendations from the CDC and from our state health department. The CDC currently recommends wearing a mask indoors if you're in an area of substantial or high transmission, regardless of your vaccination status. And Cumberland County is in a community in the red or high transmission. The recommendation continues to be that you wear the most protective mask that you can. Ideally, that's an N95 or KN95, but as long as you wear it well, it fits you well and you wear it consistently. They are recommending universal indoor masking for all students in K through 12 settings for students, teachers, staff, and visitors. And then as a reminder, the CDC's order also requires masks on public transportation, including school buses and vans and trains and airports. So we still have the requirement from the CDC for public masking and on public transportation. We get a lot of questions about how effective masks are. The CDC published this their MMWR a couple of weeks ago, and include data during the Omicron surge about how effective masks wearing is. And so I thought it would be helpful to review that. So people who reported always wearing a mask in public indoor settings were less likely to test positive for COVID than those who didn't. And that varied by type of mask that you were wearing. So the respirators or the N95s were the most protective. You're 83% lower odds of testing positive for COVID. If you had a surgical mask on, that reduced your odds by 66%, 66% lower odds, and wearing a cloth mask was 56% lower odds. So that's why you're seeing the recommendation to wear the highest level of mask that you can, including those N95s and KN95s. The State Health Department currently recommends, because although our metrics are improving, Omicron is much more contagious and is still spreading rapidly. So they're still recommending a layered approach, which includes vaccinations, booster shots, treatment options, and masking, and that everyone wear a mask in public indoor settings. And again, you'll see this echoing the CDC guidance that says wear a well-fitting mask, a high-quality mask, N95, a K95, or surgical mask. So over the last several days, we've seen some updated guidance from our state health departments and are anticipating additional guidance for K through 12 and childcare settings. So I just wanted to review the masking requirements as it relates to isolation and as it relates to quarantine. So for both childcare settings and K through 12 settings, regardless of your vaccination status, if you test positive for COVID, in accordance with the CDC guidelines, you can come back to school for childcare 5 days after your symptom onset, or if you don't have any symptoms, it'll be 5 days after your test date. That person must continue to mask for additional 5 days when they come back to school. So you quarantine or you isolate for 5 days, and when you come back, you have to continue to mask for an additional 5 days, so days 6 through 10. And if you are not able to do that, you must isolate for 10 days if you do not mask, unless an exemption applies. They have also last week updated the quarantine guidance. So the quarantine guidance as of Friday is such that in K through 12 settings, and I'm anticipating that the child care guidance is going to get updated as well, hopefully today, that individual contact tracing and exclusion from school is no longer recommended and for K through 12 schools and child care settings. So that means that if you are exposed to COVID-19, we're not excluding you from school after an exposure. However, there are guidelines from our state health department about notifying potentially exposed students. And we've been working closely with our school district staff in the last few days to make sure that we are on the same page about how parents and staff can be notified or will be notified if they have an exposure in their classroom or in their school. So the recommendation still stands. Even though you can remain at school, you should be notified. And then in addition, if you are exposed and you come back to school, that you should, although it's not a requirement, wear a well-fitting mask for 10 days after your last exposure. So you can come back to school, but we want you to come back to school in a mask and to get tested. So in summary, I just want to put this all together sort of in a nice, neat package of what's happened since the since we first implemented the abatement order. When we first started, we were in Delta. That was a much more contagious variant, higher hospitalizations, certainly more death, and you've seen that reflected on the slides today. We're now in a new wave with a new variant, the Omicron variant, which is even more contagious than Delta. The good news, it seems as if it has less severe consequences as it relates to death, although we're still seeing elevated hospitalizations, partially because of the sheer number of people that have been impacted by the Omicron variant. The recommendations continue to be to wear a mask, and a well-fitting mask, the highest that you can tolerate, N95, a KN95, when you're in high or substantial transmission like we are in Cumberland County. Our case positivity rates remain high. However, we are trending downward very quickly. Our case rates also remain high. However, again, we're trending downward very quickly. We've seen large drops in our case rates over the last 2 weeks. Our hospitalizations are higher than we had in July, which was our sort of our upswing of in our pre-Delta surge. And so they're higher than at that time, but again, those are also trending downward. Our overall vaccination coverage has increased from about 45% in August upwards of above 50%. However, and at the time we did not have vaccinations for our our group under the age of 12, and now we do. We still have lower vaccination coverage among our 5 to 17-year-olds, our school-age children, and our booster coverage remains low. We need to get more people boosted. We do have weekly testing available. So I want to talk a little bit about testing capacity. Our school district, Cumberland County Schools, in collaboration with the state health department, has a really robust testing program in which children are able to get tested on a weekly basis in schools. And so with their parental consent, and it is an optional program. And right now we have about 10%, less than 10% of our students participating in that program. We do have expanded testing capacity and out of school settings. So about 40 test sites plus more than 40 test sites. We have them popping up all the time. Our children are 5 to 11 are also eligible to be vaccinated. They were not at the time of the abatement order. However, we still have an age group, our children under the age of 5, that may become eligible to be vaccinated sometime in the second quarter of the year, but just aren't eligible quite yet. And then we also have several treatment options available that we did not have at the time of the initial abatement. The challenge of the enforcement of the abatement order has become a challenge. We continue to, when we get a report of a complaint, we reach out to that facility, that business, try to provide education, making sure that they are aware of the order is still in place, making sure they have resources. But the enforcement of it remains a challenge. And I have the county attorney with me today, Mr. Rick Moorfield, so he can help answer questions about enforcement. In particular, in recent days, last week with the vote of the Cumberland County School Board, they voted to go mask optional. And so in order to enforce that order, that would be a challenge for us to enforce that order. And so we are wanting to get feedback from the board today, ask questions, have you an opportunity to ask questions, and then we'll have some kind of next steps for you. But I wanted to pause there and see what questions you have, including any questions about the abatement order and the enforcement of it.
Dr. Green, this is Dr. Fleishman. I just wanted to add, if I can just add a couple comments about what the health system's seeing related to Omicron compared to the Delta surge.
Yes.
Is that all right? Can you hear me? Yeah, so I just wanted to, I know you said that deaths are down, and you're right. The percentage of people infected with Omicron is significantly higher in the community, but our hospitalizations were significantly up in the month of January, to where in the last couple of weeks, in the end of January, early February, we were up to almost 190 people in the hospital with COVID. And in the month of January, we had 90 deaths associated with COVID, as compared to the biggest peak for us in September was 85 with Delta. It is clear that the people that are dying from this, it is a disease of the unvaccinated. The people that are dying and the people that are being hospitalized grossly are unvaccinated individuals. In the ED, in the emergency department in January, compared to August, when we had Delta surge, we had 1,072 visits in August of 21 ED visits related to Delta. In January, we had 2,621. Almost two times plus the number of ED visits in January. And we continue in February. We've already had, February 9th, we had at least 15 deaths in the month of February. So we've seen more deaths on track with Omicron than we have with Delta thus far. But you're right, in comparison to the number of people being infected, it's a much, much lower rate.
Yeah, that's a great point. Thank you for clarifying it. Yes, the numbers of people, because there's so many people being infected, it makes the death rate feel small, but there are many, many more people being impacted by Omicron than there ever was with Delta.
Yeah. So from a health system perspective, again, it's a disease of the unvaccinated.
And that that reflects in our statewide data as well. The state puts out a surveillance report every month, and I believe last month when I looked, or last week, I'm sorry, and it hasn't been updated for this week yet, about 66% of our hospitalizations were among those that were unvaccinated. A smaller percentage were among those that were vaccinated but not yet boosted and were eligible to be boosted. And only about 2 or 3%, less than 5%, were among those that were vaccinated and boosted. So reiterating the importance of getting boosted. Are there other questions about the abatement order, the data that was presented?
Dr. Green?
Yes, sir.
This is Mr. Larch. Regarding the abatement order, do I recall correctly that the Cumberland County Commissioners met and directed that you use your authority to issue that order?
That's correct. So in August, prior to the board meeting, the county commissioners met and made a recommendation that I use my authority as the health director to implement the public health abatement order, which we did follow and did that. And Rick, I don't know if you want to add anything there.
It wasn't a direction, it was a request.
A request, yes. Thank you. Yes, it was a request. Yes.
Okay, so you retain the authority to withdraw the order without the commissioners necessarily voting on it or directing it?
That's correct, yes. They requested I do that, which I did. It was the appropriate thing to do. But they we're not required to vote and frankly, neither is this board is also not required to vote to rescind the order. However, we wanted to make sure the Cumberland County Commissioners had an opportunity at their meeting last Thursday to ask questions, provide their feedback. And we wanted to make sure, as the Board of Health, that this board also had a chance to ask questions, provide feedback before we took any action. We thought that was appropriate because you're the governing portion of the governing body for the health department. And do you want to say anything else about it? Okay.
Okay, thank you. I was just trying to understand the process, and I was not aware of that meeting last Thursday, so thank you for clarifying that.
Yes. Are there other questions or comments before I can propose that?
This is Dr. Fleishman again. I would just say that, based on recommendations and guidelines, and what's going on and where we're at with the percentage of infections in the community, to me, the recommendations, at least from my perspective, what we should recommend is pretty clear based on the CDC guidelines and what the science is telling us. I think that the issue comes down to what's a pragmatic approach and to what we can really recommend versus what we mandate. And I'll leave it at that.
So I think it's important to say a few words about, to your point about the pragmatic approach. So to enforcing the order is a challenge. And Rick, if you don't mind helping us understand the process to enforce the order, I think that is helpful. And just for the benefit of the public and the board to know the immense challenge of actually enforcing the order. Yeah.
I don't think it'd be hurt to smash them. The real concern that Dr. Green had with the school board's decision is that as her numbers show, the percentages, that's probably the students are probably the largest population of unvaccinated persons in the county. And unless she makes an effort to enforce the order against the school board, it just really is untenable to keep it in place and just let that slide. And she and I have talked about it at great length. The process for enforcing it is she would first have to send a direct order directed specifically to the Cumberland County School Board for her to comply with the existing order. If they fail to do so, then the next process with my office would pick it up in terms of a civil action against the school board. And I talked to Dr. Green about this. I think Dr. Fleishman indicated that is just not practical. I mean, my office doesn't want to any more than Dr. Green wants to have the county sue the school board. That's basically what it would boil down to. So based on that concern, my recommendation to Dr. Green has been that she continue to recommend the guidance of the CDC as to masking. And right now that guidance still is that for schools, everyone should be masked. But rather than get into a situation where the taxpayers of the county are funding a lawsuit from the county against the school board, that is just not untenable, and nobody wins in that situation. So it's been my recommendation in discussing this with her at length that because if she doesn't try to enforce this, there's really no more credibility left. I mean, this is a very serious situation. So, and I think based on all that, that Dr. Green has made a very rational and well-reasoned decision on how to proceed with this. And I'll be glad to answer any questions if anyone has, because it's just not a straightforward process like everyone thinks, but it's it's just a statutory process that we have to go through.
So what we want to recommend, or what I'd like to hear from the discussion from the boards, is about rescinding the public health abatement order. And we're prepared to do that, and we've drafted some language that we can put into effect. I do want to make clear, though, that the CDC recommendations, the recommendations from our state consortium of the ABC Collaborative, the recommendations from our state health department are really to think critically about what's going on in our community in terms of masking, and when is it appropriate to lift mask mandates and to put them in place. And we have to look at, and which is why we have these kind of two summary slides here, we really have to look at what's our testing capacity in the community. Do we have vaccines available? We do. We have testing available, but we have lower vaccination rates among our school-age kids, and we have lower participation, for example, in our school's testing program, although it is quite widely available and it is in place and up and running. We just have a lower participation in that than we would like to. And so while we would recommend, or while we would want to hear discussion about rescinding the order, we still strongly recommend masking in schools until we can get some of our case rates down, our positivity rate down. You heard briefly that the state health department is shifting to allowing individuals in school to remain in schools after COVID-19 exposure. So masking for those students is still important because there is still some level of risk there. It's lower, but we want to make sure that we're protecting those that are in the school building, including those that are not yet eligible to be vaccinated, those that are maybe only partially or not up to date with their vaccines in some format. So I just want to be clear that rescinding the order does not mean we think that masking was not effective. Rescinding the order does not mean that we think we shouldn't be wearing a mask. The guidance from all of our partners is really clear because we are still in a higher level of transmission, because as Dr. Fleishman said, we are still seeing a large impact to our hospital system. We'll probably continue to see our death rate go up. It's still critical that people continue to wear a mask, continue when they're in indoor public settings, and take that action so that they can protect themselves and those that are around them. And so I'm going to stop talking there, but I just want to get some feedback from the board.
Well, everybody's not speaking up. This is Dr. Fleishman again. I'll go ahead and speak up. Dr. Green and everybody else. Dr. Green, I am supportive of the stance that you are suggesting and all the things that you just said as far as the recommendations. We, as a member of the Board of Health and certainly as part of the health system, I strongly recommend that people should continue to stay masked in enclosed areas and the recommendations you just said. I really want to recommend, especially about being vaccinated and the protection it provides for hospitalization and serious illness, not only for the children, but for the teachers, their parents, the children's parents, and their grandparents, because of the transmission that can occur in the schools that can go back home to their families. But I do agree with the approach and the stance and support your decision on this.
Dr. Green, this is Cynthia McCarthy-Kearney, and I too agree and support the stance as well, that we have to do whatever we can to encourage adults, individuals to do the right thing, to protect themselves, their children, and the community. So I strongly agree with Dr. Fleishman to support your decision and efforts.
Dr. Green, this is Jennifer Brayboy Locklear. I concur with the previous board members who just spoke. We can continue to encourage, but I fully support your recommendation.
Dr. Green, this is Bart Pfizer. I obviously support your recommendation and agree with what everybody else is saying. I just have a couple things that concern me with the rescission of an abatement, and again, not to just almost as devil's advocate. What concerns me is that I think Dr. Fleishman summed it up well, is that we have the highest population of people with the lowest population of vaccination in the highest density, meaning school buses and classrooms. That could, I guess the word is, it's the spread of the transmission rate would be high, bringing them back home into grandparents' homes, siblings, and I just worry that we're looking at a 26% positive rate. And while it is going down, considering that that's a good number to start taking masks off, it makes me nervous. I also believe that, with the school board voting to go optional, to me, I have a 14-year-old in the school system, so I am biased. But I believe when you say optional, that means none. I think that it'll be difficult to monitor who has it and who doesn't, who should be in the 5-day mask wearing policy and who shouldn't be. That being said, I obviously support you in your decision. I would just want to make sure that we message it that says the rescission of the abatement is not a support of the fact that this is over, but that, and I think one of the board members said it well, is that we have to strongly encourage those to protect yourselves. I'm just concerned that everybody is doing this a little too early. That's just my point. Sorry to ramble on.
No, I share your concern. I share your concern. I think while we have a widespread availability of vaccinations, we have testing, we have treatment options, we need people to actually take part in doing those things. And you're right, our hospitalizations remain high. We have that's our biggest group of individuals that are unvaccinated. And while the enforcement piece of it may not be practical, the recommendation does not change. And so I just want to be really clear about that. And we will be working with the school district on the messaging of this and making sure that it is immensely clear that individuals should be wearing a mask when they are at school. And partially in some places it is settings that will be required. For example, on the school bus, or if you come back after a positive COVID test, will be required to do so. And to your point about the logistics of doing that, of tracking that, is a conversation that we've already begun to have with our school district staff. Think about how do we make sure that while protecting everybody's privacy, making sure that children are wearing the mask when they're required to do so. so that they can protect the teachers and their classmates and everybody else that is in the building. But I want to be clear, you're right. This is not a risk-free option. We are in a challenging space right now. We're moving in the right direction. I want to be, for the public that's listening, we are not talking about wearing a mask forever, but we need to make sure that we are protecting those and not overwhelming our hospital system at the same time.
Dr. Green, this is Dr. Cynthia McCarthy-Kearney. In thinking about that and trying to understand the practice in the schools, are the masks available? Do the schools have any responsibility in that? Do they provide masks for children?
So I know our school district has worked to order masks, at least for our teachers and adults in the building. Through our state health department, they offered schools opportunity to order N95. And so I believe that process is underway. There might be some delays in shipping, but that process is underway. We also have N95s available at the health department. As soon as we can get them, we push them out the door for individuals. And then if it's been a long 2 years, but if my memory serves, our school district did provide masks to students when we first started COVID-19 and making sure that students had masks available. So, and I believe they also have them available, for example, on the school buses if they arrive without one. So the availability of masks, the availability of getting a mask, while not always free, they do work to make sure that they're available to students.
Very good, because I was concerned, even though we encourage the reinforcement, if it's not available, then it's obviously not effective in trying to reinforce something if the schools are not partaking in this partnership to try to provide this for those who will wear masks to try to protect themselves and others.
Yeah, our school district staff have worked really hard alongside us and on contact tracing, goodness gracious, on the contact tracing and making testing available, we've worked with them to have that. I know both the hospital system and the health department have worked to roll out vaccination clinics on school campuses, next to school campuses. We need and are urging the public to take part of those efforts along with us. I did want to say a word about timing of this. So as I pointed out, the Strong Schools Toolkit, which governs what the control measures that the schools are required to implement and in our child care settings, will go into effect on February the 21st. So what we'd like to consider is timing those pieces together so that both of those things go into effect at the same time. So that would mean rescinding the order at the end of this week, and also rescinding the order at the end of this week, meaning on Sunday, and align it with the timings that the Strong Schools Toolkit and in anticipation that the Child Care Toolkit will also go into effect on February the 21st. That also for businesses, and we've been talking a lot about schools, but for businesses and other institutions that have relied on my order for their mask policy, we want to give them time as well to implement their own masking policy. So I think a lot of folks in the community, based on the number of phone calls that we've received, are relying on our mask policy to require their employees or their citizens or the public coming in. So we want to make sure that they have time to review their own policies and then implement their own masking policies, in particular for those individuals that serve or settings that serve populations that have lower rates of vaccination. So what
Dr. Osadi. For the weekly testing that's available at the school system, do you know what the processing time for the results are?
So it has varied based on the surges and ebbs and flows of the pandemic. So right now it's rapid testing. So they get those results the same day. I believe our school district has also offered in some instances PCR testing. And so that will, of course, be a longer time frame. But the state health department, and they're working with the state health department through a laboratory called MACO to provide those rapid testing, those rapid tests on site. So very quick turnaround time to identify. And again, I think the parents can still help enroll in that program to help identify those cases quickly, and so we can keep as part of our mitigation strategy in schools.
Let's see. Now, say for example, there's a concern that a patient a student may have been positive for COVID and experiencing some symptoms from it. Is there a way for the nurse that you have to be able to test for and provide that rapid testing to be able to kind of pull them out before they infect other kids?
So the toolkit, let me see if it's on my slide here. So the toolkit actually requires, if you're symptomatic, to also go home. So even if you're symptomatic and you haven't had a test yet, you do have to go home. We presume that you will be positive. And if you come back to us tomorrow and you have a negative test and you've been fever-free, or you go to your healthcare provider and you have an alternate diagnosis, you can come back to school. But until you get that test result or you have an alternate diagnosis, we presume you're positive, even without the test, and you go back one slide, and you are sent home for the 5 days, unless again you have that alternate diagnosis or you're presumed, or you have a negative test.
So what do you get in a situation where the student is symptomatic but doesn't want to speak up, and the teacher might see them not feeling well? How do we know that the teacher is actually going to make the right decision and not be passive about it with regards to getting that kid tested?
Well, our school has and I'll give credit to our school partnership here. They have created a form that teachers can fill, teachers or the faculty can fill out, that indicates the symptoms for whatever symptom the student is experiencing. They can check that box, and then that goes to the administration team, and then that student gets excluded from school. The child gets sent home with a note with instructions that say you're presumed positive, you need a doctor's note, or you need a negative test to come back. And so it's certainly not a perfect system. It's very hard to tell if somebody has a sore throat, perhaps. And so we do rely on parents to help us keep their kids home when they are sick, and we rely on our teachers and our school staff to help us identify kids that are sick, especially with those those common COVID-19 like illness symptoms. But you're right, it's not a perfect system, especially during cold and flu season.
I mean that sounds great. I'm just kind of anticipating that if they do make it to where it's optional for the masks in a week and we can't really stop it, or that doesn't work, at least we have something that will a system that will just make it a little easier to be able to identify those who are infected and take them out of the system. But I do think we have to kind of look at, how can we emphasize that? So in case that it does, we don't get to kind of keep those masks on those kids, to be able to communicate to the parents, either by letter or some sort, to emphasize the importance of being more diligent now that the masks are not mandatory anymore.
Yes, you're right. So, and I'll say, if you are confirmed positive or you're presumptive positive and you come back after your 5 days, let's say you never had your test, you do have to wear a mask even if you're presumptive positive after your 5 days. And so, or when you come back on day 6 through 10. So we've also utilized a couple of tools throughout the pandemic to communicate with parents, and their PIO office has worked with us to do, for example, coffee conversations. We record video that gets pushed out to all the parents. Our school partners do a good job of helping us with the messaging on their social media, and of course we'll echo those recommendations as well. We know that again, this is not risk-free, and that some will try to evade the system here, but we need parents to work alongside with us. We want to provide the opportunity for students to remain in the classroom when they're not symptomatic and they're not positive. We want to make sure that they can be in person for classroom learning, but the way we do that is for everybody to kind of work together. We want them to play sports. We want them to be in athletics. We want them to be in band. But the way we keep those things rolling and avoid clusters of cases and shutting down of classrooms is to make sure that everybody's doing their part.
Sounds great. Thank you.
Yes, ma'am, Ms. Campbell.
I appreciate the zeal with which you have approached this situation, the overall situation, and the participation of board members. Unfortunately, I think that it's a situation that did not have to occur, especially in the way that it did, and I'm not condoning that, because I'm staying in my lane. But I think the way you have proposed that we do has got to be translated into legal and common sense terms when you go to the public. I support the decision. I don't like it. I don't like the fact that we have to do this, but I support the decision.
It's tough, and I think our team at the health department has talk about losing sleep over this, but trying to make sure that we are thinking about how do we keep our community safe, and not just for schools, but how do we keep our community as a whole safe, protect those that are the most vulnerable, protect those that are not yet vaccinated, and we want to be really clear with our messaging that frankly this is partly an enforcement challenge, but the recommendation is still there. We did not this is not an indication that the pandemic is over or that we are in an endemic phase yet. We're not there yet. We are getting there, and we have the tools to get us there. That's the good news. We have masking, we have testing, we have treatment options, we have vaccinations, we have boosters, we have all of these things, and we can put us on a path so that we don't have to wear masks anymore. But right now, while we have high hospitalizations, we really need to be, we need to make sure that we are putting those measures in place.
Dr. Green, just to echo, I agree with everything you said, but I can't say enough that our best defense is vaccination. And to prevent hospitalization and death, people need to get vaccinated, especially those that are the most vulnerable, adults and elderly adults. And I can't say that enough. And if we're gonna, do this, that we're going to do, I understand what that means for our children, but what that also means for their parents, our teachers, and their parents, their grandparents, and other adults in this community. So I can't say that enough.
Yes, and I'll make a public service announcement. We continue to provide vaccinations at the health department. Frankly, we have seen our vaccination numbers slow down in the last couple of weeks, and so we need people. It is not too late to be vaccinated. If you have not got your booster, we need you to come get a booster shot. That is our best line, our most effective line of defense that we have, and it's available to you. We are continuing to do a number of community outreach events around the community. We're going to continue that at least for the next several months, and then as we get our youngest children vaccinated, we will also make sure that they have opportunities to get vaccinated. So when it is time for our 6 years old to 5-year-olds to get vaccinated, we need everybody to come get their kids vaccinated so that we can protect all of our community members.
Thank you very much, Dr. Green. You have done a wonderful job, and thank you to all the board members and staff of the department and everybody that has helped us. It's a hard place to be. I agree with all the recommendations. Thank you. Do we have any more comments, questions?
I have one more comment. So just so the board is aware, what our plan is next is, based on the feedback, is to issue a release to the public that really encaptures all of the conversation that you've had this evening, so that the public is aware that we're sending the order effective on Sunday, giving people time to make their own mask policy, aligning with the school, the strong school toolkit from our state. Still, all of those strong recommendations, boosters, vaccinations, all of those things. But we're going to issue a release and then also update our website so that all of those things that we talked about get reflected on our website. So we're going to be working on that here in the next probably tonight and tomorrow as well. So we can expect to get some of those updates back.
Thank you very much. Thank you. Thank you all. At this point, I would love to inform board members to please review the attendance roster on page 43 and communicate any discrepancies to Ms. Ellie. The floor is open for board members. Do you have any more comments? One minute.
Okay. I'm sorry.
Do you have any more comments from board members? Okay, in that case, thank you very much. The next regular board meeting is on Tuesday, March 15th, 2022 at 6 p.m. May I please have a motion to adjourn this meeting?
Move to adjourn.
Adjourn.
Second.
All in favor? All in favor?
Aye.
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 Thank you very much. And be safe. Have a nice week.